Hello, class. Now we're going to chapter 4 in our community health class. Communicable and non-communicable diseases. Prevention and control of diseases and health conditions. These are just simple English words. Communicable, when something you can communicate, you can pass on information from one person to the other. Here, you can pass disease, infection from one person to another when we talk of communicable. And you have the non-communicable, you cannot pass those diseases. And I want you to pay attention as when we start going into the chapter. When you hear communicable diseases, what are we talking about? When we talk of an infectious disease, what are we talking about? Because with the last chapter, we used, most of the time, we use the word infectious disease. Infect one person, the other. Now we're going to understand how this infectious disease, how does it being communicated or passed on from somebody who is infected to somebody who is not infected and then become infected. And some of those diseases that are non-communicable, you cannot pass them on. Some of them are lifestyle related. And we can see as we go, as we advance into the lecture. Now, these are some of the objectives. It is expected that when you're done with when we are done with this lecture, you should be able to explain the differences between communicable, which are infectious, and non-communicable, which are non-infectious diseases, and between acute and chronic diseases, and provide example of each. So please, as you read this chapter, try to understand, first of all, if you understand what are communicable, at times, communicable when we're talking about disease is the same as infectious diseases. And non-communicable or non-communicable is the same as non-infectious diseases. And between what is an acute and chronic diseases, and provide examples of each. Describe and explain communicable and multi-causation disease model. Communicable, multi-factors that contribute to the disease. Explain how communicable diseases are transmitted in a community using the chain of infection. When you have a chain, you put on a chain, what does it mean? It's a cycle. The only time it stops being a chain is when the chain breaks. But as long as all the knobs are in place, it's continuous. It's a cycle, a revolving. So most of the time, what happens, especially with in public health, our biggest interest is to break that chain so that it stop infecting people. Okay, the chain of infection model, and use a specific communicable disease to illustrate your example. We will, as we continue with the chapter, to get to that point, explain why non-communicable diseases are a community and public health concern, and provide some example of important non-communicable diseases. Explain the difference between primary, secondary, and tertiary prevention of disease, and provide example of each. List example List and explain the various criteria that communities might use to prioritize their health problems in preparation for the allocation of prevention and control resources. List and discuss important measures for preventing and controlling the spread of communicable diseases in a community. List and discuss approaches to non-communicable disease control in the community. Define and explain the purpose and importance of health screening. Outline a chronic, non-communicable disease control program that include primary, secondary, and tertiary disease prevention components. First of all, you go with the introduction. Diseases and other health conditions are classified in several meaningful ways. Most of the time, you have to classify things so that you can find a better way of addressing them. Classifications can lead to prevention and control strategies. Classification of disease and health problems. In community health, diseases are usually classified as acute or chronic. Acute, less than 3 months, then it disappears. Chronic, more than 3 months, you are with the disease. And at times with chronic, it lasts even longer depending on the situation. Communicable or non-communicable. Communicable versus non-communicable diseases. Now, communicable infectious diseases, those diseases for which biological agent, now most of the time they are called pathogen. This can be bacteria or virus. These are biological, these are organisms, agents, or with product are caused or their product are the cause and that are transmissible from one person to another. The biological agent or their product are the cause that are transmissible from one individual to another. Say, for instance, you're thinking about, say, malaria. The, the female mosquito is usually the one that needs blood, human blood, for them to have the ability to lay eggs. So in the process, they secretes that saliva into the human being, which carries the malarial pathogen. So that person gets infected with malaria, and the next time the mosquito goes for a feed, sucks blood from that person, that disease is transmitted to other people. Then you have the non-communicable, non-infectious diseases. Those illnesses that cannot be transmitted from one person to another. Identifying cause is difficult because many factors contribute. Acute versus chronic diseases and illness. Diseases classified by duration of symptoms. Acute. Acute diseases in which the peak of severity, the peak when the symptoms are really at their highest, occurs and subsides within 3 months. Patient gets sick. Within 3 months, they experience all the symptoms, all the pains and this, then it subsides. Can be communicable or non-communicable. The acute diseases can be communicable or non-communicable. And we shall see when they are communicable and when they are not communicable. Chronic. These are diseases or conditions in which symptoms continue longer than 3 months and can be communicable or non-communicable. Now we go with the communicable diseases. Now, in the infectivity, how does it happen? The ability of a biological agent to enter and grow in the host. A biological agent enters and grow in the host. And you know, the host is the one that houses the pathogen. Say, for instance, with STD or STI, sexually transmitted infections. Somebody with gonorrhea act as the host. And when they engage in unprotected sex, they pass on that to an uninfected person, and that person become infected. So the agent is the cause of disease or health problem. The cause of the disease, the pathogen, the mosquito, the tick, the STD. And yes, right now we can say the coronavirus. The host is the person who is susceptible person or organism invaded by an infectious host. See, when somebody becomes infected with the COVID or the coronavirus, they now act as a host. And they provide that environment in which the agent grows and that agent can be passed on to other people. So that's why when you see people, public health is advising people to wear a mask in public, is to make sure that to be on the safer side, not knowing whether you have the virus or not, is to prevent you from being infected with the virus or from you infecting other people. So you create a barrier so that if somebody has the COVID, when they talk, because the COVID exists in the air, speeds and droplets. So if you're very close by and are not wearing a barrier, it's very easy for you to inhale the virus. And when it gets to you, you become infected. And if you don't adapt those proper public health practices, you pass on that disease to other people. So for now, this COVID is just a very, very good example of communicable disease. The pathogenicity, the capability of a communicable agent to cause disease in a susceptible host. And most of the time, those people, susceptibility was people with other chronic conditions, people who are sick, whose immune system is compromised. I said this pathogen became much more destructive within minority populations simply because they are likely to have some comorbidities, heart disease, lung issues, cancer, diabetes. So that made them susceptible to being infected. Now, biological agents of diseases. You have viruses and the diseases that they cause. Chickenpox is caused by a virus. The human immunodeficiency virus, which causes HIV, called HIV. The disease that they create is acquired immunodeficiency syndrome, AIDS. Then you have rectitis. Now the cause, the disease they cause is the Rocky Mountain spotted fever. Then you come to bacteria, Vibrio cholerae, the name of the agent. Then the disease they cause is cholera. Then you have also certain forms of bacteria that causes tetanus and others that have also contributed to plagues. Then you have the Lyme disease. So these are all forms of, say, the agents you see here. The agent, the name of the agent, and the disease. You have protozoa. You have the amoebic dysentery. You have the plasmodium. Falciparum, which causes malaria. And trypanosoma. Under the protozoan, you have also the African sleeping sickness. You have fungi and yeast. You have the athletic foot. Then you have the nematoda, which are worms. So these are all possible agents, and these are biological. See, most of the diseases can be caused by either a virus, bacteria, you have the protozoans, the fungi and yeast, and nematoda. This is what you need to understand. Now, if you look at it, you have a triangle. First of all, how many parts are there in a triangle? Or how many sides? There are 3 sides. Now, if you take out any of these sides, it quits being a triangle. And for infection to occur, You remove any of this, the infection ceases to exist. And what what people are trying to do, especially dealing with the COVID virus, is the agent is the coronavirus. The agent is looking for somebody who is susceptible, somebody that they can infect. And once that agent, the coronavirus, infects somebody, that person becomes the host. But within the host, there are areas within that host that the virus can exist. The environment. Now, the environment in the host usually, this, as they said, is the saliva, and it within the mouthpiece, the saliva. So the lungs, when people breathe, when they talk, it comes out. So see the cycle. Comes out, it becomes the agent again. Then look for a host, infect somebody. Then under those conditions, it can either become an agent again or it can infect somebody else. So this is very, very important to understand. You see, here is step-by-step model to conceptualize the transmission of communicable disease from its source to its susceptible host. You think of the pathogen, the agent. This agent lives in a reservoir. Under the appropriate conditions, it leaves the reservoir through the port of exit. Now, according to what people have studied, the port of exit is usually the mouth. When people talk, the pathogen is, or the virus is released into the atmosphere. And depending on the closeness of the infected person, the pathogen can be transmitted to another person. And when that person talks, spiritlets that we cannot see with our naked eyes, but for an infected person talking, they will be spewing, giving out those COVID 19 virus. So when somebody who is not wearing a mask, first of all, to keep those virus within them, not transferring it, if they don't wear a mask and become reckless, as they talk, they pass the virus to uninfected person. And that virus can either enter through the mouth or it can be it can be inhaled. That's why when you wear the mask, it covers both your nostrils and your mouth. When you wear the mask, it should cover your nostrils properly as well as your mouth, so that there's no way for the virus to enter. But again, if you don't wear, if the person that you're talking to is not wearing a mask or is not 6 feet away, the virus entered that person's mouth or his nostrils. Then establishment of infection in a new host. See how the chain, the disease existing in somebody's, this now is in the host, somebody, they hear the host, and from the host, it lives through the portal of exit through the mouth. Transmission by the air is transmitted to the mouth of somebody. So now it's portal of interest, entry. Leaves the mouth here, through the air, it gets into another mouth of somebody who was not infected, and establishment of new host. Okay, and think about this chain, spend some time so that you understand it, so that you really start to appreciate when public health says, okay, please wear a mask, keep a distance, wash your hands, avoid crowded places. They are not doing it to punish you or to control you. They are doing it to save you from being infected by the disease, because they know how this disease is transmitted from one person to another. So you take care, and we'll continue at the next lesson. Stay safe.